Okay. All right. So starting over, my name is Dr. Catalina, and we're going to be talking about how we can lean in on relationships amidst the uncertainty of the crisis. And hopefully you leave this webinar with an understanding and appreciation, which I'm sure you already do, of the uncertainty inherent in the COVID crisis, as well as the psychosocial impact of this uncertainty. I'll talk about how our relationships and how we connect with ourselves and others are impacted, both whether you're partnered or you're single. I'll also talk about how you can lean in on your relationships with yourself as well as others to move through this crisis. And hopefully you are feeling empowered and not at all alone. Because for sure, we will get through this together. All right. So as many of you have probably seen the picture of the COVID and lots of the visuals and graphics of learning a lot about how viruses spread and the spray of the 6 feet, probably, and particularly as cancer survivors, you've probably been aware of a lot of these things regarding immunity already. So for you, maybe some of this information isn't new, but certainly seeing a lot of these new guidelines from the CDC of the shutdowns of travel and the closing of borders, the closing of school and not knowing when we're going back, businesses shutting down, meetings, sporting events, hospitals changing, health departments, state departments, at all levels, our communities are changing. Certainly, we look at how our hospitals, so much of the goal of our social distancing and the stay-at-home efforts have been really to flatten the curve so our hospitals don't get overwhelmed by too many patients there all at once. And so certainly images of ERs and drive-through screenings. Just if you're unaware, certainly Los Angeles, the city, was the first city in America to provide testing to individuals who are symptomatic as well as asymptomatic here in LA. And so certainly that's something that if you are wanting to get tested, they've upped their preparedness and are able to do those tests. Our healthcare is changing. Certainly, even amongst individuals who are in hospitals, women who are having babies, there's been a lot of media on how hospitals are treating these patients. I've had certainly some patients. I had one patient who ended up having her baby at home with her doula. And certainly, we're seeing healthcare changing. And as cancer survivors, maybe many of you have been doing your follow-up visits virtually with your clinicians. What we're seeing is that very quickly, and even here at Cancer Support Community, we're having so many online groups. The way we're providing healthcare absolutely is shifting, and it's shifted very quickly, and it's asked all of us to adjust. Looking at how this is shaped, how we're actually navigating our environments. This is a picture of LA and how as much as we dream for no traffic, this isn't really what we were hoping for. And it's eerie outside, looking at the 405 and the 10, seeing images of it basically empty, very much gives a sense of definitely, hearing lots of different terms for this. Certainly, you've seen images on whether you've personally experienced it or seen it on the news of how our grocery stores have shifted, waiting in line to get into different groceries. Certainly now there's worries of food shortages. And certainly the financial crisis that has come with this pandemic, and the stock market reaching its all-time lows, and very quickly the stressors of that, and hoping certainly if and when it will rise. Teachers have had to shift how they're educating students, and parents suddenly becoming teachers, having to do this while they're working. All of these things have shifted our day-to-day, but what has certainly changed is our interactions with others and how we connect. You know, a lot of people are doing Zoom parties or social happy hours, doing their workouts online. And one of the things that you're actually seeing is that people are actually connecting more than maybe they had if they had to see people in person. And so certainly there's increases as well as decreases as far as how much people are connecting, but definitely so much has gone more virtually. And certainly there's some good things that have come out of this, as far as one of the phenomena is how we, because people are watching the news more and watching the daily briefings, how much the Cuomo brothers, I know that's where I personally get a lot of my news and my inspiration and pleasure for the day is by watching them and their and actually normalizing some of those fears when Chris Cuomo got the COVID virus, bringing it very much home. The COVID crisis was an equalizer. This, what we are experiencing right now, knows no borders, it knows no race, it knows no socioeconomic status. We're seeing all ages, even though certainly older individuals are more higher at risk, we're seeing mortality at all ages. And inherent in all of this is so much uncertainty. And you're hearing people talk about this new normal. And it's interesting because I've been in psycho-oncology for about 20 years now. And this term new normal before was really only used amongst cancer survivors. And I know amongst my clients who are cancer survivors, they're like, hey, wait a second, you know, this is actually a term for cancer survivors. So on one hand, it's encroaching on that branding, but then at the same token, it actually is normalizing, because a lot of cancer survivors, you guys are used to wearing masks, used to having to actually refrain from visiting people if you have been immunocompromised, feeling isolated, and certainly experiencing this uncertainty, waiting for tests, hoping that there's not a recurrence. And so today, this talk very much appreciates, hopefully for you, the fact that you are experiencing this new normal of life amidst the COVID crisis, in addition to the new normal that you've already been forced to face upon being diagnosed with cancer. And so today I really want us to appreciate the overlapping and how your context has shifted, and how, while there are differences that of course inherent in being a cancer individual impacted by cancer, you and your family, there's stressors that are unique to you. This is also this collective stress that we are all experiencing, that we are experiencing together. And so really what we're seeing is a compounding of stressors, okay? So really what I'd like to begin to talk about is acknowledge some of the real psychosocial impact of what this uncertainty actually is causing. We are certainly seeing higher rates of anxiety, depression, PTSD, certainly feelings of loneliness. Substance use is increased. And again, for those individuals who are fortunate enough to continue working, having to work at home and suddenly be able to work 40 to 60 or however many hours they are in their home, while also maybe having to take care of their kids, or their home office not being set up actually for work. certainly is also leading to burnout. I think one thing that isn't talked about enough is the fact that because we don't actually have somewhere to go, many people are just working, working, working. I'll be honest, I'm kind of a victim of this myself. I mean, you know, it's easy to be on your phone or your laptop and continually checking emails or doing work. There's really nothing concretely stopping you. And and so a lot of people are not even noticing this burnout because they really don't have any forced stops. Certainly, there is a lot of financial insecurity inherent in this crisis. Um, and with that, unfortunately, a lot of job insecurity too. With 30 million people already filing for unemployment, people waiting for the checks from the government to pay their bills, new statutes made to protect people who are renting and mortgage payments. All of these things are real impacts. And this is the thing to keep in mind, and why I put this figure on the side is that all of these psychosocial impacts of the COVID crisis are above and beyond already any emotional distress you may have been experiencing. So again, really what we're seeing is a compounding and exacerbating of perhaps already existing distress. All right. So what is this distress actually looking like? First off, roller coaster moods. Certainly, I don't know about you, but certainly I've seen it in myself and with all my clients of where it will just feel like this. And again, likening this to when you experienced your cancer diagnosis and treatment, we actually expect that amidst this collective stress we're experiencing, 4 moods to go up and down a bit. Know that that's expected, okay? Lethargy and fatigue. One of the things that actually happens, and I'll talk more about this, is that when our body experiences stress, remember, it goes into fight, flight, or freeze mode. And generally, all of that means is when we fight, we get tense. Everything vasoconstricts. Our muscles get tense. And so through all of that, what ends up happening is that over time, cumulatively, we're going to experience fatigue. And if you have been, I mean, when thinking about your cancer experience, when you experience fatigue, particularly if you've had chemotherapy or radiation, are some of the biggest symptoms. So you can very much appreciate that. So perhaps you may find yourself actually getting triggered by additional fatigue that you're experiencing now, that the COVID crisis has experienced, because we can get triggered by physical symptoms as well as environmental or triggers of what someone says or something we see. So certainly our bodies are drained. So if you're noticing yourself just feeling heavier, slower, just not wanting to get out of bed, know that that may be that you're distressed and your body is really overwhelmed by the distress of the COVID crisis and this uncertainty. You may notice yourself having trouble concentrating, particularly if you are trying to work from home and you're on the computer or you're constantly on video calls. One of the things that happens when we experience distress is that our mind automatically is thinking, whether or not we are conscious or not. If our body is aroused, our mind is already processing something. Again, you may not be conscious of it, but an example may be that you may think, oh no, when am I going to get paid? Am I going to get paid? What am I going to do? When am I going to see my doctor? If those thoughts are constantly going on in your brain, you're unable to actually encode new information. And in turn, you can't recall that information when you need it. And then next thing you know, that's where we get distracted while we're doing things. You may notice that someone may have said something to you and you don't remember anything that they said. Again, know that those are common. Cognitive deficits are one of the biggest and often first signs of distress. Social withdrawal is another thing that you may be experiencing, where you're just not wanting to hang out with friends or do these, family FaceTimes or parties. Right now, there is a lot of pressure and people wanting to do that, particularly now that we're further into this social distancing and lockdown. You may find yourself, even within your house, if you're living with your family, needing more space. Again, fight, flight, or freeze. Our body sometimes actually is going to begin to avoid things that are overwhelming. And sometimes right now, know that this is your body protecting itself. That begin to notice who you're resonating towards and who you're resonating from in your relationships. And know that right now, your body is basically in survival mode and trying to just get through it. That's absolutely within, understandable and natural. Perhaps you now are noticing changes in your eating. Certainly, whether or not you are overeating or wanting sugary or saltier foods or losing your appetite. Again, those are common shifts when we're experiencing distress. Okay. Changes in your sleep. This certainly is often one of the biggest things that we're going to see. Having trouble falling asleep or waking up somewhere between 1 and 4 a.m. and feeling really alert, particularly if you were having a dream and you find yourself waking up. We call this intermittent insomnia. And what this means is that you actually fell asleep and your body's still aroused, meaning that your body's experiencing that physiological arousal and it thinks it's time to wake up. Okay, so after it's got about one sleep cycle in, when you wake up in the middle of the night, your body's like, oh, I got to get up. And so what you may see if you're experiencing more severe anxiety is that maybe you'll have hot sweats. And amongst cancer survivors, one thing that can actually be triggering is that perhaps, particularly amongst female cancer survivors, if you experience hot sweats during chemotherapy, then this actually might be a trigger for you. Now that the COVID has come, you may feel, if you're getting a little bit more anxious, that may be triggering if you're having hot sweats, or seeing some of these symptoms that you experienced during your cancer treatment. And certainly, again, this is also where, unfortunately, we may see more self-destructive behavior, more substance use, smoking cigarettes, not exercising, eating poorly, and using alcohol or illicit drugs. Now, I want to spend some time to just acknowledge some risk factors, sociocultural risk factors, particularly amongst what we're already seeing in some of our research looking at distress associated with the COVID is certainly individuals, older adults, as well as individuals who already had chronic diseases such as cancer, individuals impacted by cancer, are at higher risk for distress. Children and teens, because again, where they are developmentally, maybe if you have kids at home, you may notice that this is a very hard time for them. They need structure. And for them, this is pretty important for them, their period. And it's very hard for them to withdraw from and be ripped out from their schools. So we really need to empathize with that. And certainly, individuals are essential workers, are healthcare providers, first responders, grocery workers, are custodians, people who are still out in the public. Unfortunately, what we're seeing, There's this recent research looking at Chinese healthcare workers, where we are seeing high rates of depression, anxiety, and distress reported. Unfortunately, maybe this week you heard about the ER doc who committed suicide in New York. Certainly, if you have a family member or a friend who is still working, appreciate that this is a very stressful time for them, and reach out and encourage them to self-care. And again, we're going to talk more about that as I go on. People who have already mental health conditions or problems with substances. One of the things, and this goes the same with being impacted with cancer, individuals who go into these situations with distress already, or histories of anxiety or depression, already are at risk for exacerbating or making that distress worse during this crisis. Okay, so if that relates to you and you don't have support, certainly listen to what I'm hearing as far as some strategies, but then also know that you can reach out for support. Certainly ethnic minority status. We are certainly, not only are you seeing health disparities across minority status and ethnicity here in the US, more individuals, people of color, are getting diagnosed and experiencing worse severity of COVID, but they are also experiencing more distress, as well as migrant status, immigration status. We're seeing also individuals who are lower socioeconomic status and having their jobs and financial security. Those individuals certainly are more at risk for distress. And individuals who have very limited support or live alone or at higher risk of experiencing distress. So now let's move into talking about how the COVID crisis impacts us, particularly, and I'm going to talk about how this impacts us first, relationships as couples, but then I'm also going to talk about how being singles, and I'm certainly single, how this affects our relationships. So one thing is that a lot of my pictures, to note, are heterosexual, but certainly all of these, what I'm talking about, applies to all sexual preferences. So keep in mind, one of the new things that's happening now is that if you are living at home now and still able to work, is that couples are now having, instead of having 40 to 55 hours apart and at work, and able to have space from each other and have their own lives and almost maybe personas at work, now they're working from home. And depending on where you live, not everyone has separate living spaces. Certainly when you think of a lot of couples in New York, they're in a one bedroom, there's not a lot of separation. So certainly if you have dual workers at home, now just that having to be in the same space with work stress and being confined, one of the things you're seeing is just more tension at home. The other thing that you're seeing that I mentioned earlier is that now individuals and couples are needing to be workers, partners, parents, as well as teachers. Their roles have expanded, okay? Quickly and with no preparation. And the one thing that's really happening with couples is that, and maybe you already experienced this when you were diagnosed with cancer, but if there were problems in your relationship, this crisis is going to put them right in your face. You're going to be smacked with them, okay? So now it's really hard for a lot of couples to ignore some of those underlying problems that when they went to work, they were able to, and then just the hustle and bustle kind of just move through things. So what you're really seeing is tensions heightened and more irritability, more nagging, more arguments. But unfortunately, what we're also seeing throughout the world is also more domestic abuse. So if you or anyone you know is experiencing any domestic abuse, immediately know that you can call for help. You can call 911. Uber or Lyft will come and pick you up, and there are absolutely resources for you. You are absolutely not alone. This applies to both women and men. If you are experiencing domestic abuse, you do not have to stay at home with your partner or the person you're living with, okay? All right, now let's give some attention to how singles and dating has actually shifted. Certainly, dating amidst the COVID crisis absolutely has shifted. Now there is no, there was definitely some scares at the beginning of this where people weren't practicing social distancing. They confused what quarantine buddies were, meaning that a lot of people were breaking social distancing to see each other and to go on dates. This picture is not social distancing. That actually is not effective way of dating. And so it's very important for us to know that there's actually different ways of connecting. We're seeing a lot of people using more online dating and doing more texting and FaceTiming. And I really encourage singles to actually use this as an opportunity to get creative, watch movies together, play games, take the relationship slower rather than, and I focus on sex. So I'm saying this, that you can still get to know one another. You can have internet sex or Skype sex as well as sexting. There's lots of ways to still connect while staying at home. But we're seeing that actually online dating is on the rise. So now I want to talk about what our brains are wanting amidst this uncertainty. Our brains are wanting three things. They are wanting control, predictability, and consistency. Those are the three things, and perhaps you really appreciate this once you got diagnosed with cancer. But control, predictability, and consistency. So there is a lot amidst this COVID crisis that we can't control. We don't know what's going to happen once our cities, what this new normal will look like. And even once we do open up, and they're still figuring this out in the states that have opened up, there's so much uncertainty. So what we want to try and do is find places in our day-to-day, look for opportunities where we can control and make things predictable and consistent, okay? So I'm gonna start off with strategies that you can do to cope on your own, as well as what you can do to support your partner and help your relationship, okay? So on your own, first and foremost, acknowledge that fear, anxiety, and loneliness absolutely are normal, subjective, and ever-changing, meaning that it's natural to feel these ways. These are just emotions. And that I'm not saying just to minimize, but they are emotions. And we can't control our emotions. We can move through them. And one thing to keep in mind is that emotions are subjective, meaning we experience emotions and they are shaped by our perceptions, shaped by the lens of that we are carrying and holding in that moment. And yesterday morning I was taking a walk and talking to one of my friends from grad school who's also a psychologist, and she told me the quote, "Time is relentless." And I think that that's how we should really think about emotions, as relentless. They are always evolving, moment to moment. And that's important for you to remember, because sometimes you're going to be experiencing this severe fear amidst this uncertainty. And one of the things you have to know is that that will evolve. Okay, so we need to appreciate and acknowledge those emotions. We don't want to repress them. We don't want to try and hide them, and we don't want to try and ignore them. So once we acknowledge our emotions, we want to sit with them. And maybe you've heard this where sit with your feelings, and it may seem unrealistic. And I'm not necessarily saying just, oh, physically sit. I'm saying stay with your emotions. Don't run away from them. Okay? What we're trying to do here is increase your window of tolerance. Again, remember, I told you your emotions may be like a roller coaster. That's okay. What you want to do by sitting and acknowledging these emotions is that you are training your body to know, okay, if I sit through this, I'm going to move through it. And then once the emotion passes, you've now taught your body that you can actually cope with that emotion. So what you want to do is when you're sitting with these emotions is begin to connect to your body. Notice what's happening to your body. I always recommend doing body scans, and I'll talk on other grounding strategies, but notice, where are you feeling tense? Like I certainly get tense in my neck, or maybe I'm having a headache. What's happening to your body? Immediately, when you begin to connect to your body, you're bringing yourself into the present. And then you're able to actually, your body, when you're in the present, worry can't exist, because all worry is worry about the future. And regret is regret about the past. When you focus on what's happening with your body in the moment, you're actually focusing on the now. So what we want to do is train your body to increase your window of tolerance so that your body is able to tolerate more of this up and down, so that eventually those different emotions won't hit you so hard, okay? And your body won't physiologically react as much, okay? Next, once you're able to stop and pause and notice what's happening in your body, then you can then begin to access your thoughts. Again, this is really important, because maybe you've done, you get all this advice and say, oh, just stay positive, challenge those negative thoughts. Well, the reality is that your body is going to react first. Your body knows first. And by the time you've already maybe spiraled, your body has already been aroused. So that's why you first need to settle into your body, ground yourself, and then begin to challenge those negative thoughts. And the thing is here is once you notice those negative thoughts and challenge them, you're trying to weigh out the pros and the cons. The goal here is to look at what you're actually thinking. Like, are you overgeneralizing? So everything is bad. The world is coming to an end. Those types. Or are you minimizing your fears? Are you saying, oh, I'm just being a baby. I'm just being scared or weak. So there's lots of these cognitive distortions, and noticing what you're actually doing so you can objectify it. Because the goal when you have negative thoughts is not to just, oh, good vibes only. And it's not just to be positive and shiny all the time. The goal is to balance the evidence for that negative thought, because you're not crazy. There is a lot of this harsh reality that I just started my talk off with. There is some fear there, but also against the evidence against it, to then have a neutral thought. The goal isn't positive or negative thoughts. The goal is to neutralize that thought. So an example is if you might be saying, I'm never going to be happy again. This is an example of an overgeneralization, where perhaps the evidence for it is that I woke up anxious this morning, but the evidence against it was actually I enjoyed my family time. So a neutral alternative thought would be, okay, oops, up, 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 sorry, would be, okay, so I woke up anxious and will have my ups and downs. And right now I'm choosing to move through it. One of the things when you're doing this process, again, is bringing yourself to the present and focus on what you can control. Finding your choice, telling yourself, and I'm a big advocate for talking to yourself, what I'm choosing to do now to move through it. Okay. All right. Another thing that you can do to self-care and to get yourself through this is make one small promise to yourself every day that is realistic and achievable, and to keep this promise. So things like, shower or brush your teeth. It literally can be as small as that, because let's just be honest, not everybody's doing that, and that is absolutely okay. But finding something, because your body, when it's overwhelmed and distressed and amidst this uncertainty, again, something that you can do to build back trust that you have for your body and your own choices and control. Okay. And self-care is the best care. Again, trying to eat clean, exercise, taking walks. We're lucky here in LA that we do have beautiful weather. Walking, again, socially distancing, resting. This is the time to catch up on your sleep, and certainly experiencing pleasure. Again, when I'm saying pleasure, laughing, anything that brings you pleasure, touching, even giving yourself hand massage. When our body experiences pleasure, immediately it relaxes us. Our body really, it refuels us and it heals us. When we have, particularly if we are able to release oxytocin, then our bodies get refueled and energized. So maybe all of these, not all at once, but trying to do your best to take care of you. Okay. So, and again, these are just some routines, and maybe, my slides might be available alongside my talk, but keeping in mind a routine and really balancing and staying active, and really just being kind to yourself, okay? Reaching out for support. Now I want to talk about how you can lean in to your relationships with your partner and protect your relationship so that you guys get through this together. And I love this picture because it actually is a little bit realistic for a lot of couples who I've been seeing. Is this idea of, all right, we're getting through this, but you know what? I need my space. So a couple things to keep in mind when we're thinking about how couples are going through this COVID is that during stress, is that everyone is going to revert to our go-to reactions. Meaning that when our body is overwhelmed and in stress, particularly if that stress is chronic, and maybe you noticed this when you got diagnosed and were in treatment, our body is just in survival mode. And so it's trying to protect itself. And that's where we're just going to have some go-to reactions. So if you find yourself, immediately defensive, then, or irritable or snappy or talking down or just avoiding, if those are some of your go-tos, what you're probably going to see is in your relationship, you're probably going to do that more often. Okay. If you notice that, know that that's actually pretty much the process that happens. And that's why I want you to begin to do some of those strategies that I just said on your own to begin to actually manage that. The other thing to keep in mind is that now may not be the best time to heal those old wounds. While, definitely relationships are getting a lot in these existential crises. And again, you probably can relate to this when you got diagnosed with cancer. Our heads immediately focus on our relationships with our loved ones. And it can make us question a lot of these relationships and want to make them better. But the thing is that when you're already overwhelmed, it may be hard for you to work through some of these wounds. So be realistic, and pick your battles, okay, as far as what you want to work on your relationship. And really focus on connection, not disconnection, okay? Because again, when your body's trying to protect us, we tend to disconnect from ourselves, our own bodies, as well as our partners. So really trying to focus on connection rather than disconnection. All right, so keeping in mind that our partners, absolutely, if we think that we're experiencing distress, so our partners absolutely may be experiencing distress as well. So remember to lean in on the relationship, connect, and this is where you build that trust. You lean in on that trust in the relationship to support one another. And plan time together and apart. Even if you're working a lot, it is absolutely okay for you to go on walks by yourself, for you to have happy hours by yourself, watch movies by yourself, work out. Plan these things together and apart. You do not have to do everything together. Prioritize intimacy. And again, I'm not just talking about intercourse. I'm talking about quality connection time. Give each other massages, take baths together, give each other foot massages, hand massages, just cuddle up and watch a nice movie together. You have to actually schedule it, and it is absolutely okay to schedule sex, okay? It's important for you to prioritize intimacy, to again, connect. Share household responsibilities, again, particularly if you were used to a cleaner and maybe don't have one now, definitely share those. And really take the time to explore your relationship, not necessarily fix anything, but to explore it and take that time together. All right, now I want to talk about how you can lean into your relationship and support one another, okay? The first tip I can tell couples is really not to try to fix your partner's problems. Try not to say things like, calm down or relax. You know what I think when people tell me to relax? Let's just say it doesn't make me relaxed. It actually can be fairly minimizing. So really trying not to do that. And also, when we try to fix someone else's problems, the thing is that there's particularly when this is existential. And again, go back to when you got your diagnosis and were going through your cancer treatment. The reality was that if people were trying to do this for you, you can probably empathize, right? And didn't want some of that. What did you want? You really wanted people to listen. And maybe you needed to vent or bitch or cry and listen and just feel whatever it was you felt. The reality is that oftentimes we know what we need to do, but knowing, doing, and being are three separate things. And we can know sometimes, but we may not be able to do. And that's where our partners may get frustrated, or we may get frustrated with them. So we focus on telling them, do this, when really we just need to be. Okay? So hold space for your partner. Know that you are, just like you're overwhelmed, they might be overwhelmed too. And you may be wondering, what the heck is this hold space? Is it super like hippity dippity? What does that actually mean? I love this portrait from India. It basically just means show up. Show up for your partner. Actively listen, focus, and follow. Use simple reflections like the mirroring technique, where you'll repeat back 1 to 3 words that they'll say using their words. So for instance, somebody's saying, gosh, I'm just so pissed off at my boss today. I just want to quit. You can say, gosh, you sound pissed off and you're really frustrated with your boss. Really just being present, being a reservoir for them, holding that space, not judging, not giving your opinion, literally just being there. It's actually easier than it may seem, because when you're trying to fix someone's problems, you have to actually come up with something. So when you're just holding space for someone, it's actually easier than you might think, okay? The next thing you could do is co-regulate with them. Again, so our bodies, when we are stressed, our bodies are aroused. When I was talking about that window of tolerance, our nervous system is aroused. And again, it's wanting to just fight, flight, or freeze. The first thing that our body is wanting is, the first system that gets engaged is our social engagement system. As mammals, and specifically humans, we are social beings. And what we're looking for is connection. We want that social support. And so the way you can connect with your partner is actually to regulate your nervous system with theirs. Okay, and how do you do that? So maybe you've noticed that when your partner's really stressed, you find yourself, next thing you know, you find yourself maybe tense or scratching yourself or feeling restless too. The first thing you can do is a grounding technique. And we call this the 5-4-3-2-1 technique, okay? And it goes, it's very easy to do, and I'll just say it briefly. It's 5, what do you see? I see the sunshine. 4, what do you hear? I hear cars outside. 3, what are you touching? I'm touching my thigh. 2, what do I smell? I smell coffee from this morning. And 1, what do I taste? Toothpaste. So what you're doing by going through the 5-4-3-2-1 technique is you are transferring your brain activity from your amygdala to your prefrontal cortex. So that the amygdala is basically where you are experiencing your emotions. And when you're experiencing those emotions, your brain is sending messages to your body to arouse, okay? What you're doing by grounding is in shifting that to the prefrontal cortex, you're problem solving by counting backwards, 5-4-3-2-1. Now your body is in problem solve mode. And then when you connect your senses, that makes you more aware of the present, connects you to your body, focusing your attention and grounding you. This is something that you can do alone and then with your partner. You can say it aloud and get you both to do it together so that you can co-regulate your nervous system with theirs. Another strategy that you can do is box breathing. This is where you can inhale for 4 seconds, 2, 3, 4, hold for 4 seconds, 2, 3, 4, exhale for 4 seconds, 3, 4, hold for 4 seconds. And this is actually something that you guys can practice together, laying in bed when you're having a hard time to sleep. One of you can do the counting, tapping the other person's hand, so that not only are you breathing and regulating your breath together, but then by touching them, you're regulating them that way as well. Touch is one of the most efficient ways to regulate our bodies. Touching ourselves as well as touching others can immediately decrease our arousal and tell our body that we're safe. And another thing we can do to support our partners is to empathize. Connect. Don't compare. Remember, you do not have to be in the exact same situation to empathize. And again, think back of when you were diagnosed initially and going through initial stages of cancer. Oftentimes, again, many of your oncologists and nurses probably didn't have cancer before, but you felt empathy from them. You do not have to have the exact same situation to empathize. Empathizing is putting yourself in their situation to be able to say, what would I do? What would I need? How would I feel? And again, actively listening and simply reflecting, using their words to reflect back, okay? You do not need to fix their problems. And one thing that I think is important in our relationships is being very mindful to identify and assert and enforce boundaries. Remember, boundaries are not things that we can tell others to force them to do something. Boundaries are lines that we write in the sand that we have to enforce so that if other people overstep them. So an example of this may be after, at the end of work, maybe your partner is super, super stressed and they come in and they just bombard you by complaining and you find it really stressful. A boundary may be, I need at least an hour to decompress beforehand before you actually begin to share your worries or stressors of your day at the end of my day. If you do come in out of after work and start decompressing so immediately, I'm going to then enforce my boundary by going into my bedroom. I'm going to take space, okay? That's an example of how you can enforce boundaries. All right, and again, going back to our singles, one of the things is keeping in mind to date safely. And again, here, even though you are, all of those things certainly apply to you as you're dating and meeting new potential partners, but remembering that even though you are not physically with them, you absolutely still can have boundaries, can always have boundaries of how someone interacts with you, how they enter your space, whether that be virtually or face-to-face, okay? And it's very, very important. All right, and then one of the last things that I think that we can share together is also when thinking about pleasurable activities is having fun together and even sharing fun things that you find on Instagram. I am absolutely addicted to Samson the Dude, and these are these golden doodles in Connecticut, and this little boy who sleeps on them constantly, and I think they're all siblings, and they are the cutest, but finding things that, you know, like with the cancer support community, they're doing these silver linings, sharings, finding things that actually bring you joy and sharing those with your partners or your loved ones. You know, amidst a lot of this crisis, it is important. Our brain really is just scanning for threat. That's all it's wanting to do. It's on guard. So you actually have to intentionally look for some spots of sunlight and positivity, okay? And then share those. When we pay it forward and we share that gratitude or that positivity, that also calms our nervous system and relaxes us. Okay, so some take-homes for today are, first and foremost, stay connected. Stay connected with yourself and your partner. You are not alone in any of your feelings. If you're feeling isolated, scared, alone, you are not any of those things, okay? Know that we are all in this together. This collective stress is real. And on top of being a cancer survivor, know that this is compounding that. And so if you're feeling overwhelmed, know that again, you are not alone in that struggle. That self-care is the best care, okay? Whether or not you're partnered or single, focus on your self-care. We can't help others unless we take care of ourselves first. Always remember that. And support loved ones and your partners while maintaining boundaries, okay? Again, this is part of your self-care and very, very important. And again, I'll just say it, stay connected to yourself and to others. We will get through this together, okay? We will get through this together. And I know I covered a lot on this, and I really wanted to give you guys lots of concrete tools, but you certainly, if you have any questions or if there's any support I can provide, feel free to reach out to me on my website at theintimacydoc.com, or you can email me at connect@theintimacydoc.com, or you can find me on Facebook. I have a YouTube channel or Instagram. Thank you, guys. I think we're going to try and open this up now. We're going to stop recording. And so if you have any questions, feel free to shoot those in. Okay, I'm going to, hold on, keeping that in. And I think, are we opening these up to questions? Let's see. Okay, why don't you guys raise your hand if you have any questions, and I will see you raising your hands. Or you can put your mic on and I will hear your questions.